Hi, I'm physiotherapist Jussi Karkila and we are going to do now tennis elbow or golf elbow treatment with a 6D tape. So tennis elbow is a condition that usually comes as a painful area on the lateral outside or on the golfers in the inside. It can also be extended on the whole arm on the both sides of the joint. Usually it's a repetitive work that causes the pain, for example chopping the firewood, drilling, hammering, etc. 6D tape handles are designed to aid the user to mobilize the tissue in 6 dimensions. And the 6 dimensions means front and back, from side to side, and up and down, and the rotation on each direction. The mobilization of the tissue has a positive effect to the lymphatic system, fascia, blood flow, scar tissue, muscles and joints. And by activating the tissue up and down with the handles, we aid the metabolism and the fluid flow in the tissue. The 6D tape has very sensitive skin-friendly adhesive, and you will recognize it immediately when you roll out the tape away from the skin. It damages the skin very, very little. The package itself for tennis elbow, you will need 1 2-handle strip and 2 3-handle strips for the taping. And before the taping you should also shave the area if needed. You should always clean the area as well by skin cleaner. So by following these steps you will get the best adhesion for the tape. If you have somebody to help out the taping, it is easier, but now we will demonstrate how to do it yourself. So take first the 2-handle strip and you cut the back paper into 2 halves and take the back paper away a little bit from the side. And then between the handles you should place it on the clavicle bone so that the first handle is coming above the clavicle bone and the other one is coming underneath. Don't stretch the tape like that, yes. And then you will first take the upper part and then press down the tape into the skin like that, and then the lower part you do the same thing and then press the tape firmly into the skin. And it is very important to press it really well towards the skin like this. If you would have a left tennis elbow, you would of course tape the opposite side. Then you will do the taping for the elbow and you cut the back paper and leave the middle handle like that, and then you should have the elbow a little bit bent like you usually keep your joint like that, and then you would start from the middle handle like that. You adhese, glue it, and then you do the upper part. Take a little bit of the back paper away and then you attach the tape without not stretching it like that, and then you can take it all the way up. And then you would do the same thing for the lower part. and attach it from the sides first and then from the end. Yes, and then from the middle really firmly rub it into the skin. And then please do as well the inner part. So if you do have a tennis elbow, it is recommended also to do the inner side because of the lymphatic fluid system, how it flows and activates. And we do the inside as well and have it a little bit bent like that, and then you start from the middle again and then do the upper part. And then you do the lower part. And rub it very well to the skin from the middle towards the ends. So as I said, for the better results it is recommended to tape both sides for tennis elbow, but if you would have a golfer's elbow, which means the inner side is painful, so you can just tape the inner side. So for the activation now, how it starts the self-treatment is that please, if you activate from the upper handles first 15 to 20 times, like 1 minute approximately, to different directions, and this activates the lymphatic system, and this is always the starting point. And do the other handle as well. And the second step as we continue is that you start lifting from here and pumping up and down gently. And do the other one. And then the third. And then we do the other side. And the middle one. And the last. And now the third phase is that you can start by moving the handles into 6 directions, please, from there, the different, following the 6D method, 6-dimensional movements. And the other one. So this is a self-treatment tool, and one treatment should last from 5 to 10 minutes, and you should do it every 4 hours, the minimum. But basically the more you do, the better it is, the better results you will achieve. Towards the end of the treatment, so then once again lift it and pump it up and down, like this. And then the second one, the third, and do the same thing here on the other side. And the last one. And then end up the activation as they're pumping the handles on the subclavicular area. If you get any symptoms of irritation or itch, you should remove the tapes. The contraindications for the use of the tape is acute infection, deep vein thrombosis, or malignant tumors if they are still under the treatment. When you remove the tape, so rub it very well first from there, and then you can just tear it from the beginning, from the end, and then peel it alongside your skin gently like that. Great. Thank you for choosing 6T tape for your tennis elbow treatment.